to the Zulekha Hospital's second cervical cancer awareness campaign. My name is Helena Stevens. I'm the Assistant Director of Nursing in Dubai Zulekha. We have some clinical experts here from the fields of obstetrics and gynecology, and also oncology specialists here to speak to you. We also have some high-profile figures from the Dubai community. Let me introduce our esteemed guests.
On behalf of Zulekha Hospital and my colleagues and guests, I'd like to talk a little bit about cervical cancer. And I'd like to start with a patient who I saw about 2 years ago. As you know, I'm a medical oncologist. Patients come to me when they have exhausted all their options for treatment. This patient was 35 years old. She was busy in her young years. She was going to college, pursuing a career. She was then getting married late in her late 20s. She didn't have time to go see a doctor. She didn't have time for pap smear. She was busy, like many of us. She was pursuing a career. She married late. Her husband was always traveling. And at the age of 34, she presented with vaginal discharge and irregular bleeding. She was scared. She didn't want to see a doctor. She came to me when her tumor has spread through her lungs. Cervical cancer is a cancer of the uterus. It's on the neck of the uterus. It is a cancer that's contracted by a virus, like many other viral diseases like measles, a virus that we could have prevented by vaccination. If she had been vaccinated in her early teens as a child, she would never have gotten the risk for having cervical cancer. Had she had a pap smear, we could have probably detected her cancer very early and eradicated it right then. Even at an early stage, cervical cancer can be completely treated with very, very little side effects. Unfortunately, when the cancer has spread, death is almost imminent. Cervical cancer is not a disease.
We are here just to encourage such campaigns, and our doors are always open if you think we can have a more support for you for doing this to the Society of Dubai and to the UAE. And as you mentioned, cervical cancer, it happens all over the place, and the UAE is no different. And a couple of years back, it was really kind of a stigma to talk about cervical cancer, like it was like breast cancer. Cervical cancer is no different. And I think we need more like campaigns like this for the community to make them aware of this cancer.
Once you become sexually active, you are exposed to the virus, so better to take the vaccine before you become sexually active. Ideally between 11 to 26 years, and nowadays they say that even from the age of 9 we can start vaccinating both boys as well as girls, because just vaccinating girls wouldn't solve the problem. We have to vaccinate the boys as well.
Hi, my name is Pamela Munster. I'm an oncologist from the USA. I am also the Director for Oncology Services at Zulekha Hospital here. Our campaign is about preventing cervical cancer in women in the UAE. This is a cancer that's completely preventable by either vaccine or regular pap smear, so we don't want to miss an opportunity to save someone's life. Be aware, get tested, get vaccinated.
I'm Dr. Betty John, consultant gynecologist. I'm working in Zulekha Hospital, Sharjah. We are conducting a month-long cervical cancer awareness program as a part of Zulekha Group awareness program. Here we are concentrating on two things: to raise awareness among women as well as men regarding a cervical cancer, which is totally treatable and preventable disease. During this campaign, we are focusing on two things. One is a simple test called the PAP test, which can detect this cervical cancer at a very early age. And second thing, we are focusing on vaccination. Vaccination is against the human papilloma virus. It is called the HPV vaccine, which can prevent this HPV viral infection in children. So we are trying to focus that maximum number of children receive this vaccine, and this vaccine should be received by children from the age of 9 years, and anyone beyond 9 years can receive the vaccine up to the age of 25, and this will prevent infection from human papilloma virus, which is the main cause of cervical cancer. And our second goal is to make women aware that there is a very simple test called the PAP test, which has to be done every 3 years, and this test will detect cervical cancer at a very, very early age, where treatment is very easy. My message to women is that if you love your family, please get a pap smear done and please get yourself vaccinated.
My name is Zanubia Shams. I'm the CEO of the Zulekha Healthcare Group, and we're currently running cervical cancer awareness campaign. And what we're trying to do is raise awareness about the causes of cervical cancer, about how it can be prevented. It's one of the few cancers that's actually preventable, and there's a vaccine for it. And we're encouraging people to go out there, both men and women, to take the vaccine, because once you take the vaccine, for women, it obviously helps them to prevent cervical cancer, and in men, it helps them to prevent a whole lot of cancers that might affect them, some types of skin cancers, anal cancers, rectal cancers. So it's a win-win situation for both men and women. Please go out there, please get yourself vaccinated, please get an HPV vaccine, please get your young children vaccinated as you would for measles or mumps or rubella or chickenpox. Please make sure you're doing this very same thing for your children, boys and girls both. And for the next few months, we at Zulekha Hospital are going to be offering free pap smears and discounted pap smears after some time. So, take advantage of that. Ladies, please come out there. Please do this for yourself. This is something you need to do for yourself. You need to do this for your families. If you are going to be healthy, you're going to be there to take care of them. If you're not going to be healthy, you're not going to be able to take care of them. So here's the interesting thing about cervical cancer. It's preventable. So if it's preventable, and you can prevent it, because once you actually get the cancer, its effects are very, very debilitating, and it's very difficult to cure. It's easy to prevent but difficult to cure. So take that control in your hands. Thank you very much.